Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, so in the hepatic injury, first we will see the diagnosis of hepatic injury now. In the diagnosis of hepatic injury, first liver injuries are first diagnosed. See, if the patient is an unstable patient, now it depends upon whether the patient is stable or unstable. Okay, first and foremost, there is an hepatic injury. Once the patient comes with hepatic injury, you should see whether the patient is unstable or if the patient is stable. Okay, if the patient is stable, if the patient is unstable, then first we will do a fast examination is done. In unstable patient, first and foremost, we do a fast examination. Okay, and then we see whether there is injury or not. If there is an injury, the patient is already unstable, then you can directly go into a laparotomy. Okay, then if the patient is stable, in a suspected stable patient with hepatic trauma, you can do a CECT. Actually, this in this also you can do a fast examination can be done for screening, followed by CECT can be done in the patient. Okay, then followed by CECT can be done. First we do fast and then CECT can be done. Now, in the CECT, when you see that there is contrast extravasation is seen. In the CECT, if you see that there is contrast extravasation is seen in the CECT, then this states that there is in the CECT abdomen, if there is contrast extravasation, then it indicates the presence of pseudoaneurysm or active bleeding external to the liver capsule. That it indicates that there is pseudoaneurysm or some active bleeding is seen external to the liver capsule. Then on CECT abdomen, sometimes we can also see presence of beer claw sign is also seen. If there is multiple liver lacerations are present, then this will manifest as beer claw sign is also seen in CECT abdomen. So here you will see that there is fast examination you do, and on CECT 1 you can find the pseudoaneurysm, or you can see the liver lacerations can also be seen on the CECT.
thank you and thank you for watching.